This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about how often can you get a steroid injection. If you like this video, we put out new content weekly, so please like and subscribe. So if you're watching this video, maybe you've had a steroid injection, maybe you're thinking about getting another steroid injection, and the question is, how often can I get these? If you talk to a lot of people, they'll say once every 3 months. Now, that's more of a rule of thumb, and where that comes from is kind of confusing. There's no hard and fast rule of how often someone can get a steroid injection, and a lot of times insurance companies will only pay for an injection every 3 months, so the doctor will tell you you can only get one every 3 months. So that's not necessarily a medical reason, it's more of a financial reason. That being said, is there harm in getting, so there's risk to getting multiple steroid injections. If it's injected into a tendon too often, it can cause the tendon to rupture. This is extremely rare. I think there's let's say Achilles tendons and patellar tendons are known to rupture, and the best literature review I can find of a patellar tendon was they did, I think, 9 injections in weightlifters' knees, patellar tendons, in a given year. That was the average amount that caused rupture, with the low side being 5. So you generally have to do a lot of them, and people don't normally inject steroid into Achilles tendons, so there's not too much literature on that. But that's a rare complication. For something like knee arthritis, getting a lot of steroid injections isn't going to make. So there is some thought that it will degenerate your cartilage, that the steroid does. The literature is very mixed on this. The consensus seems to be if it's a lower dose steroid, it can actually have the opposite effect and preserve joints. Well, if it's a high dose steroid, it may cause some death of some of the cartilage. With what I use triamcinolone. They did a study where they took people and they injected their knees every 3 months with either placebo or steroid, and then after 2 years they took x-rays to see if there's any progression of arthritis, and they didn't find any progression. The only difference was that the people who had the injections had slightly better ranges of motion, but it was barely statistically significant. So there is that thought there. I mean, really what it comes down to is if you get a steroid injection and it helps you, it just depends on how long it lasts. If it lasts a week or two, I mean, it's usually not worth doing again, unless there's another area that can be injected that's not the same spot, which happens. Sometimes you have pain in multiple areas, and taking care of the pain in one area unmasks the pain in a different area. But if someone's getting months of relief, then it's reasonable to do again. If I'm seeing someone for the first time, then we have that conversation about what tends to make most sense. But there's no really hard and fast rule for any of it. But again, I would advise against seeing someone who just wants to keep giving you steroid injections in the same spot and none of them are working. So, I mean, generally, if it works, we'll do it. If it doesn't work, we won't do it. Sometimes I have it where I give an injection, it works for a while, the second time shorter, and then the second time worked not long at all, so I don't offer a third injection because it's not working anymore. So these are just conversations to have with your doc. But generally speaking, you can get multiple injections in the same area and it's fairly safe. So I hope I was able to answer your questions about how often you can get steroid injections. If you have any questions I didn't answer, feel free to leave them in the comments below, and I'll do my best to respond, but I can't give you medical advice about your specific condition. If you like this video, we put out new content weekly, so please like and subscribe, and thanks for watching.